How are you guys? Thank you so much for joining today. Thank you so much for being here. I am Candace Turner. I am a clinical research diversity coordinator here for Now Included. Thank you so much as we are talking to two dedicated physicians, two dynamic physicians, about the most pressing issues regarding health in the Black community. And so today we're going to be diving into kidney education, nutrition for overall health, talking about managing diabetes, as well as hypertension. So, I want to introduce our two speakers for today. So, one of our dynamic physicians that we have today is Dr. Joi Morgan, who is based in Birmingham, Alabama. Dr. Morgan is a highly accomplished physician who is renowned for her exceptional academic and professional achievements. She has her MD, and three master's degrees in nutrition management and healthcare administration. And Dr. Morgan is currently pursuing a second doctorate in healthcare administration with a specialized focus on diabetes. And she is also the owner of the Nutrition Plug. And also, with our other dynamic dedicated physician, we have Dr. Cree, who is also based in Birmingham, Alabama, who is a board certified family medicine physician, an international public speaker, a life coach, wife, and mother. Dr. Cree is the sole owner of Brownstone Healthcare and Aesthetics, and she's also the medical director of the City of Birmingham's Employee Health Clinic, Brownstone Be Well Birmingham. And so I am so happy to have Dr. Cree, as well as Dr. Morgan join us today. It's so happy to see you guys. Hi, ladies. How are you tonight?
Hello, Candace. Hey, Dr. Creed.
Hey, Candace. Hey, Dr. Joy.
So excited that y'all are here. This is an important conversation. And I know that in your time and work, you see so many people from so many different walks of life. And one of the most common things that a lot of times we talk about happens to be like nutrition, right? Happens to be diabetes, happens to be hypertension. So I wanted you guys to just come on here really quickly and just give a brief overview of who you are and what you do and how excited you are to be here today. Starting with you, Dr. Joy.
Okay, hello everyone. It's a pleasure to be here with Now Included and also Dr. Creed. Thank you for having us. I am Dr. Joy. I'm Dr. Felicia Joy Morgan. I have my MD, but I am considered a nutrition coach as well. And so I partner and plug people into all things nutrition. And so I do that via my own business called Nutrition Plug, which is located here in Birmingham, Alabama. And I see my clients virtually.
Thank you so much for that. Dr. Cree?
I'm Dr. Cree Johnson. I am a board certified family medicine physician. I specialize in helping everyday overwhelmed, overworked individuals learn to live a healthy, happy, whole life. I'm the sole owner of Brownstone Healthcare and the medical director for the city of Birmingham. Thank you, Now Included, for having me, and thank you for hanging out with me, Dr. Joy. This is what we do, so we're happy to help you live a healthy, happy, whole life.
So let's speak about that a little bit more. What does it mean to live a happy, healthy, whole life? What does that mean to you guys?
um Want me to go? For me, I would say it is doing what you're supposed to do now so you can live a longer, more abundant life later, right? So that means going to see your primary care doctor. If you're supposed to be taking medicines, whatever that medicine is, taking it, drinking your water, minding your business, so that when you're older, you're not on dialysis, you're not on insulin because you lived well, you exercised, you did what you were supposed to do. All the things Mama and them was telling us a long time ago, they ring true today.
Mm-hmm. Absolutely. Absolutely. And I like that part about minding your business.
Correct.
Balancing, right, and doing what we're supposed to do. So I want to open the floor with talk about nutrition. Right. So for you, Dr. Joy, what is nutrition and how does it affect our overall health?
Okay, so nutrition is the act or process of nourishing our body. So that's simply what we're putting in our mouth daily. It can be nutrients, vitamins, minerals for our bodies to function properly. So today, that's what we're going to do. We're going to discuss nutrition and how we can maintain optimal health via nutrition.
So, I love that. So, what are some things that we can do to help with that optimal nutrition? So, when we're talking about key nutrients that support overall health, right? And what foods can we find them in? What would
Okay.
you say?
So when it comes to key nutrition for our kidney health, we want to get those kidney friendly foods. So first, let's start by looking at the kidney overall. The kidney is a reddish brownish color in the shape of a kidney bean. So you want to look at those foods that resemble that color of the kidney, those dark berries, those reddish brown fruits and vegetables, such as your dark berries, your dark red grapes, your radishes, your kidney beans, and things like that. That's a way to start out by associating color with that body part. You want to cut back on your meals by eating healthy meals, cutting back on salt and sugars and things like that. Cranberry is a great fruit that you can eat because it helps control your urinary tract, keep you from getting urinary tract infections. Berries are important because they're high in antioxidants. They help with inflammation. They help protect our body. They help keep down infections. So blueberries, strawberries, blackberries, those are all important. Also, cauliflower has vitamin C. Vitamin K is a fat soluble vitamin. So you want to be mindful of that also. Olive oils are very important because they're healthy fats and they're good for inflammation. They're anti-inflammatory. Also, bell peppers, or if you're eating chicken, you want to do skinless. No, because that's high in potassium and sodium, the skin that's on the chicken. When it comes to fish, your fatty fish are important, such as salmon, tuna and mackerel, because they obtain the omega-3, 6, and 9, which is good for overall health, your cardiovascular system, your kidneys, and just having a long life. So those are a few healthy things. So basically, some of those fruits and vegetables, maintaining a balanced diet, and the amount of water that you're drinking also. So I get into that a little bit later. Okay.
And I love that you brought up that you want your plate to be colorful. It reminds me of like something that we learned growing up, whether it was
Mhm.
in school or you had the pamphlets, and they say like, oh, you should have overall color, more color than you
Mhm.
have bland food, or more color than you have their meats, things of that nature, more vegetables, right? So with that, Dr. Cree, just for you, as you're speaking, you're talking to your patients and your physicians, what are some things that you have seen, or what are some things that you have told or talked to with your actual patients concerning just what they're seeing on their plate or their everyday life?
I think that the big thing for us in America is, and in the South, is our portion control. We were taught that you are supposed to eat everything on your plate, eat it whether you wanted it or not. And as we're getting older, we have to unlearn that. Now you're like, we have these smaller plates that we give out, to our patients to say, hey, your vegetable needs to be a big portion of it. Yes, you'll need a starch a little bit smaller. The meat can be about the size of your hand, but if you have kidney issues, then you may not even need this much meat. You may need less meat because a lot of that is really working your kidneys overtime. You don't think about it, but the kidneys is so integral in your diabetic health, your hypertension health, just your clearing your good toxins out, the good and the bad, all of that. We need those kidneys to be healthy and happy. So in order to do that, we're gonna have to unlearn a lot of what we've been taught in the South. Adding all the extra salt. We don't really need salt on our watermelon, do we? But we're doing it because that's what Mama said to do, right? So
Or sugar.
or sugar, right? So
Right.
we're able to unlearn as adults what was comfortable. These are comfort things that we do all the time. That now we need to say that we want to live longer, so we need to maybe be a little bit uncomfortable in that quest.
Mhm.
I love that. Like making the necessary sacrifices that you need and stepping out of that comfort zone of what you always know. One thing that has been helpful, and I know I was talking to someone the other day, what they said was, is it mine or is it ours? Right? Or is it theirs? And one of the things as an example that they gave was they said, growing up, I've always hated broccoli. Right. I've always hated it. And then when I grew up and I went somewhere and they gave me broccoli, they put some cheese on it and I threw a little, a little bit of seasoning, a little black pepper, and I realized I really, really like broccoli. And they looked up the nutritional facts behind it and they realized the only reason why I didn't like it is because my parents didn't make it growing up, right? So it's unlearning that part and stepping out of your own comfort zone and finding out that these nutritional things that we just was like, oh no, it's green, I don't like that, is actually beneficial. So
Mhm.
in addition to that, you mentioned hypertension and diabetes. So, how can we also create a balanced diet where we're focusing on things like blood sugar as well as blood pressure? Dr. Joy?
So when it comes to balanced diet, you want to consume your fruits, your vegetables, your legumes, your whole grains in your balanced diet. You want to have if you're diabetic, hypertensive, um, high fiber but low fat diet. Also, you may have heard of the Mediterranean diet, which is one of the best diets because they consume a lot of high fats, but high fiber, I mean, but low fat. So that would be cutting out your butter, your lard. Use instead of using that, using extra virgin olive oil or just olive oil for your grease to marinate or cook with your vegetables and things like that. So that's taking out your creamers. A lot of times we like coffee, we want creamer in there. You don't think that's something high in fat, but it's high in fat. A lot of times people may say, well, I'm hypertensive, but I'm not diabetic, so I can eat sugar. No, you can't, because the thing is that can spill over to kidney disease because diabetes can, in the long run, turn to affecting your kidneys. So you have to still think about just because you may be hypertensive and not diabetic, or I can eat one or the other. No, you still want to have a low amount of salt or sugar that you're eating per day. And so you want to be looking at the salt intake. That's 2,300 milligrams of salt per day in your diet by cooking your own food. When it comes to water, you want to make sure that you're hydrated. You want to make sure that you're drinking. We've all heard drink 8 cups of water per day. Well, that also depends on your body. Everybody is different. That may not be the best amount for somebody who has kidney disease because they can only drink about 32 ounces a day, especially if they're on dialysis. So for the average person, now they bumped it up to 15.5 cups 15 and a half cups per day if you're a man, and 11 and a half cups per day if you're a woman. But you want to be mindful of what your health circumstances are in on your water intake. And then you want to remember that if you're on dialysis, the kidney, what it does is it filtrates the urine, it filtrates your blood, it removes waste from your body. So if you're removing like sodium, potassium, what happens? You become dehydrated. So you need that water. You need to know what's good and what's not going to hurt your kidneys as well. So to make the long story short, a balanced diet, high in fruits and vegetables, um, but moderate whole grains because whole grains have phosphorus on it. And phosphorus is the key element that affects our kidneys as well. So you want to be mindful of those whole grains. So with cereals, you want to be conscious of that and what type of bread you're using. Also, be mindful of the vegetable intake that you're taking, legumes, beans, things like that. Making sure you stay high fat. I mean, not high fat, high fiber, low fat. So just remember those things. And that prevents disease, aspiration, and remembering the Mediterranean diet, staying away from the Western diet. What's the Western diet? What we do in the United States, fast food, McDonald's, Burger King, things like that, processed food, frozen foods, canned food, because to maintain that shelf life, it's made up with so much sodium to keep that shelf life or to keep that food for a long period of time. So if you're going to eat canned food, you can rinse those foods off, which should help eliminate some of the salt. If you're going to eat fruits, frozen food, like let's say frozen fruits and vegetables, those are better. Better, they don't have as much salt in them as like some of these microwave dinners that are high in salt. So limit those and just try to cook your foods. That way you can control how much salt and add in like fresh peppers, fresh spices, herbs, and things to your meal, substituting and leaving the salt out.
Wow. That was so enlightening and so helpful. There you said some things that I didn't even know. I thought we were still at 8 cups. I didn't even know that they actually
Yep.
increased that to 11 and a half. And I go to the doctor quite regularly and get
Mhm.
checked up. So that's something to note, right? Especially with the peppers. But I will say, when you said to leave the skin off the chicken, my heart kind of stopped a little bit because listen,
That's a
I
good
love the
part,
skin on
right?
my chicken. That's the good part. And what about us, like culturally, like we love that crunch. Like
Hmm.
we hear it,
Gotta have that
it's
crunch.
so good, right? But
But
speaking
then you
of
gotta also be mindful if you're somebody who has diabetes. So a healthy person
that,
could eat the skin. But if you're someone who has kidney disease, diabetes, hypertension, then you want to be mindful of ways that you can tackle this. You know.
mm. So let's talk about that, right? You mentioned some other ways that we can make some changes. But Dr. Cree, Dr. Choi, what are some simple changes that we can make overall, like daily?
Simple things that we can make daily is starting to exercise. You know, that's something that we definitely put off and put off and put off.
Hmm.
I think that even if you're like, oh, I only have the strength or the ability to do 15, 20 minutes in a day, that adds up. And the more you do it, the more stamina that you build, and the more your body's going to crave that. You're like, oh my gosh, I didn't walk today. I really need to get out there and walk. So we want that, they recommend about 30 minutes. That should be your goal, 30 minutes a day, up to 5 days out of the week. That's a lot. When you think about it, when we don't have time to cook or do anything else, we like on the go, on the go, on the go, on the go. Like where am I gonna put 30 minutes of walking in, Dr. Creek? You either can get up earlier, you can do it at the end of your day, you can do it during your lunch. Everybody's got an Apple Watch, everybody's got a Fitbit or something like that, where you can be watching your steps. Set your steps, a goal. Let's try and get these 10,000 steps a day. So I think for me, all of these things, the reoccurring theme is we want to exercise so we can lose some weight. If you lose weight, those kidneys are happier. Like she said, they're shaped like beans. Do you want your beans suffocating with all that fat around there? We do not want our beans suffocate. So the least amount of fat that's around them, the more they can, function. Now, that is not if you were born with genetic kidney disease. Like there are disorders like polycystic kidney disease. But if you have kidney disease based off of having high blood pressure because it's caused your kidneys to, you've not taken your medicine, it's caused your kidneys to be bothered. Diabetes uncontrolled cause your kidneys to be affected. Those are losing that weight, drinking your water, exercising, minding your business, because that's gonna keep your stress down. You'll live, will those kidneys will be happier.
Hmm.
That I love that. And you brought up something so important, right? Tiny steps make a huge impact.
Hmm.
And so I wanted to just talk about what are or how does regular exercise or physical activity actually benefit, our kidneys, our heart, and just generally our overall health.
It's going to make your heart rate go up. We want that heart rate to be up so we can be burning calories. So that's one thing. Walking and exercising, that cardio is good for your mental health. Like just think, you put your AirPods on, everybody's looking at you like, what is she over there doing? No, she is releasing whatever of the day and going on. So we're doing good for our mental health. When we're less stressed, our blood pressure can be a little bit better. When we're less stressed, we're not emotionally eating and being like, I can't wait to get home, to get in the bed, watch that TV show and eat those Oreos, kind of thing. So we're going to be walking, we're exercising, but we're doing more than just being concerned about getting that heart rate up, because we want it to be good for our mental health. We want it to be good for us to be sweating our pores out and that skin to be glowing at the end of that. It is multi-factorial.
Hmm.
Multifactorial. So, speaking of that, I want to take it back to something that I think is important for us to bring up. I want to talk about some of the negative impacts. So, like, what are the signs that number one, our diet can be negatively impacting our health, or number two, the lack of exercise or the lack of balance is affecting our overall health? So, Dr. Joy, I'll start with you, and then Dr. Cree, we're going to make our way to you.
So, some things that you said, what are some things that could be negative impacting?
That
Okay.
what are some signs that our diet is negatively impacting our overall health?
So, some signs would be possibly kidney UTIs. You're not drinking enough water. You can have urinary tract infection. Also, high blood. You notice that your blood pressure is elevated. Standard optimal blood pressure is 120 over 80. So if you're over 140 over 90, that's high blood pressure. So you want to be checking your blood pressure, getting a daily log. If you going to your primary care provider, showing them, okay, when, because you might have white coat syndrome when you get to the your doctor and it's just elevated, but at home it's not. Another sign would be someone who has your doctor told you you've been diagnosed with chronic kidney disease. You have some elevated kidney levels. You notice that you're dehydrated all the time. Maybe you need to go in and see what's going on. You're tired all the time. What else? Just not having a proper diet, you know that you're sluggish and things like that. You can't focus mentally. Those are some ways to know, hey, I'm not at my optimal health right now. I need to go see my primary care physician.
And I'll add in there too, you may have some physical symptoms. You may have swelling in your feet. You may have some chest pain. You may have shortness of breath. You may have some dizziness. Your urine may not be as frequent as it usually is. So those are some things that could be, if that's kidney related, chest pain, headache, dizziness, that could be blood pressure related, or even could be blood sugar related. If your sugar is really high, you may have a headache. You may have some blurred vision. You may be urinating more frequently, and when you go, it's a whole lot at one time. All of that, you may have numbness, tingling in your feet. You may have cramping in your legs if your potassium is really high because your kidneys are failing. So really, I challenge you guys to know your body. So that way, when anything is off, whether you think it's your kidneys, you think it's your heart, you think it's your sugar. I don't know what's wrong with me, but I know that this is not my normal. Doc, hey, I need some labs. Don't be afraid to ask. Be your own advocate. Write your notes down. Hey, I saw this on TV. Are you checking my kidney function every time I come in? What was my last blood sugar? Write it down, because if you're not your own advocate, I'll get in there and start talking to Dr. Drew about her dog, her family, her mama, and oh girl, let me refill these pills, because we're in relationship. You should have a doctor that you're in relationship with, right? So then we walk out of there, and you call me back the next day and say, I forgot to tell you, Dr. Creed, my legs were swelling. So we need to write all our stuff down. And I like it when my patient just hands me the list. Girl, give me this list. Let me write your little answers down. Oh, okay, then your legs swelling, your this, that. Okay, we're gonna check your labs. They'll call you within 48 hours. Whether it's good or bad, you're gonna get a call back or go on your portal. So we have to be our own advocates. Like she said, know what normal is. Know what normal is, and also know that you need to be monitoring. If you're diabetic, monitor your sugars at home. If you have high blood pressure, get an appropriate size cuff. If your arm is really big, you don't need to be using the extra small cuff, because every time you check it, it's going to be high. So take your blood pressure cuff to the doctor and say, can you guys calibrate my cuff and see if my cuff at home matches what you're getting here? And if not, we can say, oh, you need a 40-inch or you need a different size of your cuff, so that you're not stressing yourself out at home. And FYI, the wrist machines are not as accurate. So they may say your arm is bigger, use the wrist. They're not as accurate as if we can get it up there where we used to checking it. So those are some things, some signs and symptoms to look out for, but you have to be your own advocate.
Oh wow, no, you really just enlightened me because I know a lot of people in my family, they swear by their arm cuff. They swear by the wrist cuff. Like they use it continuously over and over again. But just understanding and knowing that you have at home cuffs that you can use is something that I think a lot of people watching here can take. But you touched on something, knowing what normal is. So, what are some early like warning signs of diabetes as well as hypertension that people should not ignore?
Okay, so some of those I'll just review because I just kind of went over these. So if you're having chest pain, if you're having headaches, if you're having dizziness, those could be signs that your blood pressure is really high, or it could be signs that they're low. So we need to know that that's a sign that could be blood pressure. If you're diabetic, and your sugar is really high, you can have blurred vision, changes in your vision. You can have excess thirst. You're thirsty, feeling thirsty all the time, numbness, tingling in your feet. You can have urinary frequency, urinating a lot. You can have erectile dysfunction, men. If your blood pressure is out of control, your sugar's out of control, all of that is vasculature. Your blood wants to go there, but you around here telling folks you don't have high blood pressure. You don't want to take no medicine, so your man parts are going to suffer. Ladies, tell them if they're not listening. Okay, so all of those are symptoms. As far as kidney disease, you can have symptoms of the cramping. You may not have any symptoms at all for any of these. You may not have any symptoms related to high blood pressure. You may not have any diabetic symptoms and still be diabetic. You may not have any symptoms of kidney issues and still have kidney failure. You may feel totally fine. Don't go in there and tell the doctor that you don't have that because you feel fine. They're going to draw the labs. They're going to confirm that. And when they see it, they're like, hey, we need to do XYZ treatment. Take it. So, but my thing is know what your normal is. I feel normal. So if anything is awry, you know to go in, run in, have the conversation, and say, check me for basic labs, my basic panels, and we can see.
Can
All
I
right,
ask?
awesome. So, yes, please do. It's
Know
your
your
show.
know your family history also. Know your family history. If your grandmother, your parents have high cholesterol, high blood pressure, you need to know that. Even down to like what age were they diagnosed with? So it was later in life, early in life. Those are the signs that you need to know and be aware of your family history as much as possible.
So there were some great questions that just came out about, like you just mentioned, knowing your family history, but not just that, knowing what normal is. Can you check my sign, check my labs, right? Check my kidney function. So are there any additional questions that people should be asking our healthcare providers about our overall health and our kidney health? And then not just that, what are some questions that we should be asking ourselves on a daily?
I think as far as our kidney numbers, kidney health is the one question you need to be knowing is what is your creatinine? This creatinine, what is your filtration rate, your GFR? What are those two numbers? Those are numbers that we want your numbers to be more than 60. That's good, healthy kidneys. So a person that's on dialysis, the filtration rate is less than 15. So you have the different stages of kidney disease. You have stage one, we're out here healthy, no be, we're living in la la land. When you get to be about stage three, where that number is between 30 and 60, that's when we start watching closely. When you get there, you may want to ask your doctor, should you go ahead on and let me see a kidney specialist so they can do further workup because this may have run in my family, or I do have high blood pressure, I do have diabetes. See a kidney specialist early in the plan so that they can be putting you on medicines to help you prevent getting all the way down to less than 15. They can optimize your blood pressure medicine. They can tell you, hey, you're drinking too much water. Maybe you just need to be drinking the thirst, not necessarily drinking the 15 ounces like the rest of the world. They will individualize that care. So we need to be sure to know our creatinine clearance or the creatinine rate, and then we need to know our filtration rate as well. Those two numbers you need to know every single time. Have your little notebook, your little journal, write that down. If you're diabetic, you need to know your hemoglobin A1C. We want that number to be less than 7. If it's in the double digits, you need some insulin, and don't tell those people you're not going to take the insulin. And if you have high blood pressure, like Dr. Joy said, we want that number to be optimal Less, 120 over 80 is of course textbook, but we want it for real to be less than 140 over 90. When you get up in the range of kidney disease and all of that. So if you get numbers that's over 140 over 90, and you're checking it at home, you're like, no, that's not what's happening in at home, and you calibrated your machine, you have some things to fight for you, because all we are getting is a snapshot. We get that 15-minute snapshot that says, nah, girl, every time you come here it's high. You got high blood pressure, because the definition of hypertension is two levels over 140 on the top and a 90 on the bottom. So if you get that two times, you should be considered to be hypertensive. I'm saying prove me wrong. So prove your doctor wrong. Take the notes in there and know your numbers.
Love that. I love that. Know your numbers. Know your numbers. But I have a question for you, Dr. Joy. But before that, Dr. Creed, can you just or Dr. Joy, can you just touch on what is creatinine? What is an EGFR? Like for people who may not be aware of that, and also, Dr. Joy, what is the hemoglobin A1C? How does that relate to diabetes?
Dr. Cruz.
Okay, gotcha. So the creatinine and the GFR is this they're elaborate calculations that are used to show how we're filtering through our kidneys. So you wanted to be going at a rate of that, like I said, the glomerular filtration rate. We want to be over 60 to 100. Sometimes your numbers over 100 if your numbers are great. But as your kidneys slow down, that number gets lower. So it's a calculation. And it's usually on your labs, guys. If you look, there'll be a number that says GFR, and then it says GFR for African Americans.
Mm-hmm.
So I got a problem with that, because this white person that we the same age, we the same yada yada yada, and their number looks much better than my African American GFR. So there are a lot of things in medicine that they look in there like, should it be the same for African Americans? And of course, there's lots of history about, well, we were enslaved, we took that ship, and we had to hold on to our urine for so long, and that's how the people survive. That the ones that can hold on to all that salt. But then now we have this genetic disposition of hypertension that is passed down some 400 years later. That's a whole nother talk. But that's your GFR and your creatinine clearance. We want to know how you clear. Your hemoglobin A1C is the average of your blood sugar over 90 days. So they come in there and say, nope, my sugars was good. Yesterday they were good, but I know you're lying, because this is going to give it to me over 90 days. So it averages out the best over 90 days. Not the best, is just going to average what your numbers are. So if you got some 60s in there, you got some 400s, we're going to come in there in the middle. And we want that average to be about 150. So 150 blood sugar, 150 blood sugar level gives you about a 7 A1C. So anything over there, if you're seeing a lot of 180s, 200s, your sugars aren't controlled. Do what the people say do. Take the medicine, diet, exercise, portion control. You will live longer because of that.
Thank you so much, Dr. Cree. That was amazing. And so, Dr. Joy, as she just mentioned, right, do what we're supposed to be doing in portion control, right? So, what are some common foods or some drinks? I know we've been talking about this whole entire time, right? We mentioned staying away from the skin, right? Staying away from making sure you're drinking your water, staying away from sodium and salt. So, are there any other things that we should look at, like common foods or drinks that we should limit to protect our kidneys?
Yes. So let's start with fruits and vegetables. So I always tell everybody to keep with your berries because they're low in calories, high in antioxidant. But what we want to stay away from, because a lot of times um, we want to know those fruits that are high in sugar. So bananas, if you're diabetic, bananas, mango. Those are some fruits that are high in sugar. They are not the best for you if you're diabetic. When it comes to sugary drinks and things like that, you want to stay away from, if you have kidney disease, you want to stay away from things that are high in phosphorus, sodium, and also potassium. So you want to stay away from those Pepsis, Cokes, diet Coke and Pepsi also What may be good are lemonade, it's phosphorus free, or light color sodas if you want to have a Sprite. A root beer is also doesn't have potassium in it. So those are a few drinks that you could do. I always tell my clients stay away from anything white, such as white rice, white bread, white potatoes, because that breaks down to what? Sugar. A lot of times you don't think about it, but it breaks down to sugar. And so to compensate that, you can do whole grain rice or sweet potatoes or whole grain breads, but also if you are diabetic, be mindful of those whole grain foods because they have potassium in it. So you want to be looking at your sodium, your potassium, and your phosphorus levels as well, and asking your primary care doctor, can you look at that in my kidney functions and in my labs and things like that. So that's just the name of a few.
To name a few, you gave a great list, I would say. um, ladies, this has been just so amazing. You have given so many great advice and feedbacks and knowledge, right? But I wanted to talk about a little bit about some lifestyle changes, right? So, how overall, like, or what are some easy and enjoyable ways that we can actually make healthy lifestyle changes that stick, right? Because a lot of times, as you mentioned, over 90 days, sometimes it takes 21 days to make a habit, right? And to stick with it. So as you're talking with your clients and you're talking with your family, your community members, what are some strategies or some tips that you've given or seen that could work well?
Well, Dr. Creed definitely highlighted a lot of them.
Yeah.
But she mentioned, I just want to, point out some things that she mentioned. 30 minutes of exercise per day. 15 minutes, by the time you get to 15 minutes, your heart rate is just starting. So that's why you want to do over 15 minutes, at least 30 minutes a day of some type of movement. That could be exercising, dancing, skating, what else? CrossFit, boot camp, walking, and go at your own pace, and then challenge yourself to bump it up. Let's say you started off with 15 minutes. Tomorrow I'm going to do 20 minutes. The next day I'm going to do 30. Or this week I'm just doing 15. Next week I'm doing 20. Then you get to your 30, and then you're like, okay, now you got a track record and you got it going. So stick with it. Get you a partner. Find somebody who's going to hold you accountable all the time. That's whether if you're going to a gym, I do accountability partnering. Let your doctor know what's going on, so they can follow up with you next time. Hey, have you been exercising like you said you were? Write out some goals. Write down what your goals are to keep you accountable, or put it somewhere on a sticky note daily where you can see it. I'm going to work out this 30 minutes today. I'm going to focus on cardio. I'm going to focus on weights or whatever it is. Just write it down and then hold yourself accountable for it. Make no excuse about it.
Absolutely. And so you mentioned accountability partners, right? So having that support system is extremely important. So how can caregivers actually best support loved ones with these chronic conditions, as in diabetes, kidney disease, and hypertension?
I think that caregivers can support by one going to the doctor. A lot of times the caregiver sits out in the waiting room and lets mama go on in there and do her visit together. But then mama comes out there and doesn't tell the caregiver a thing, So with of course, mama or grandmama, whoever needs to give the okay for us to be able to say, hey, can I just let your caregiver know that this is something that we can add? A lot of, especially for elderly people, they have silver sneakers now. That's something that they can get, like a little gym membership. Some of the gyms partner with the insurance companies. They can go and walk at the gym. They have these walking programs at the Y. The YMCA is a great resource for someone with high blood pressure, diabetes, kidney disease, because you can get in there, you can do water aerobics. They have the weighted machines. They have where you can, the walking trail. So that's something that you can get in there and do. And then you see other like-minded people. Like, oh, okay, girl, you a retired teacher too. I'm a retired teacher. I used to work over there, such and such, such. So then they make friends. They're not as lonely, And then the caregiver can say, "No, let's keep you accountable from the home front, because I'm gonna drive you there. You're not gonna tell me we're not gonna go, because Dr. Priest said you got to go over there 3 times a week." I have some elderly patients that are doing tap dancing and dance classes, and I love that for them. You know, that they're, and they have to have their family on board to say, "Hey, I'm going to be doing this," kind of thing. So as caregivers, make sure to ask some questions when you drop them off at the doctor, or send the questions in with them written down so that you can read it out. Caregivers also need to be mindful of any medication changes, because if we're making medication changes and you got that big old Monday, Tuesday, Wednesday, Thursday, Friday, and you don't realize that we've stopped taking, and they're like, "Well, what color pill is that, girl? I'm not the pharmacist. I don't know." She's not taking this metformin anymore, because the metformin, she can't have that because the kidney levels are, too high at this point. She needs to come off of that. So we need to be able to say, "Oh, here's the bottle, mama. We need to take these out of our packet," kind of thing. So the caregiver definitely needs to be involved in those visits, definitely needs to hear what is happening with the labs, but they have to have a caregiver that they can trust, not someone that they feel is going to boss them, whoop them, that kind of thing. So you are going to be partnering with them, being an advocate for them, and also being an accountability partner for the patient as well.
I love that. And you hit on something so important, trust,
Mhm.
right? During the whole entire time, number one, it's just showing trust that you, Dr. Cree, as well as you, Dr. Joy, are so dedicated to the work that you're doing
Mhm.
that you have been able to sustain relationships with your clients and your patients
Mhm.
overall. And then here today, you're showing up and providing that wisdom and the experience because you have had that trust factor for so long. And with everyone here, based off of now included, thank you so much for providing that, because trust is super big. So speaking of that, want to leave about 15 minutes to see if anyone who's watching have any questions. But last thing, like, what are some local resources or support groups that you know of that are available for kidney disease, diabetes, or hypertension, or just when we're talking about general nutrition? I mean, I know we have one here, the American Kidney Fund.
And we got Dr. Joy. We got Dr. Joy, the nutrition plug. Okay, okay.
Have Dr. Cree Brownstone Healthcare. If you're here in the city of Birmingham and you work for the city, you can go to her for free,
Yes,
right?
for free, right? You're right. So yeah, you got some
Wow.
plugs right here, some good resources right here.
And that's amazing. See, having an option or having an opportunity for free, or with you, Dr. Joy, I know that you give actual trials, right, before someone actually commits to your overall nutrition plan. But that's a resource as well for people who are still saying, like, you know what, I'm new to this whole understanding of what nutrition is. I felt like I've been doing the right things, I've been eating the right things, but what is it?
So make sure you
So I
have
see.
a nutrition
Yeah.
coach, a registered dietitian, a primary care physician.
Yes.
Primary care physician, then either a registered dietitian, nutrition coach, nutritionist. Those are all the same thing. And then get a trainer.
Mm-hmm.
Follow up with a trainer.
Yep, those were the ones that I had. I actually also reached out to a nephrologist because I was like, I don't really know if any. I'm not sending my people to a place. Her biggest recommendation was making sure they're in with a nutritionist and a diet, a dietitian, and that's coming from somebody that's treating kidneys every single day. So as far as support groups, jump on out there. You got TikTok, you got Facebook, you got groups out there where you can say families living with kidney disease. There's that. So I would say use the social media for good. That's what we have it for. That's what we need to be using it for. We got a question in the
We do.
Candace. I don't know if you see it.
I do. From Bree Robinson. Thank you so much for asking this question. It's a great question. It says, when you get blood work done, do the standard labs cover everything we need to know, or are there additional labs we should ask for that may not be included?
This is a really good question. So if you go in, and I don't know your age, but if I get some younger people that are like, I want to be checked for everything. Well, your insurance not gonna cover that, baby, because they want to cover what's medically necessary. So it's counterintuitive because I want to go in there and screen for everything, but they're not going to cover that. But if you can have a diagnosis that we can pair a complete metabolic panel, breed that's it's called a C is in cat, M is in Mary, P is in Paul, a CMP that will have your sodium, your potassium, your creatinine that we talked about, and it'll have your blood sugar on there. So if you can get that panel and what we call a complete blood count, a CBC, that has your, if you're anemic or if you have any infection, those two basic labs are worth its weight in gold because we can see if your kidneys are looking good. If your blood sugar is high on that CMP, then when you go back for your next visit, that allows the insurance to cover you drawing that hemoglobin A1C. I'll write these down so y'all can transfer that. I'll actually put that in the chat when I finish talking about them. But you can't go in there and say I want an A1C because I think I might be diabetic. You need to be saying, hey, I've had some elevated sugars in the past. Can you check my complete blood count? I mean, complete metabolic panel, and also get my hemoglobin A1C. Insurance is not set up that it's all about screenings. You have to have it has to be medically necessary, but it's pretty easy for us to find a medical necessity for those basic CBC and CMP. If you go in there with allergies or a cold, we probably can throw those in there. You know what I'm saying? So go ahead on and ask for those. And then from there, if anything's abnormal, it will push us to go and look for other things.
That's awesome. That's an amazing tip though, right? Because a lot of times we come in and what we've known, especially when we're talking about genetic testing, right, for kidneys, which is completely important because as you mentioned, there are some genetic kinds of kidney diseases out there that you may not know unless you get tested for. But insurances may not cover it. So you have to know how to frame the question. You have to know to say, like, hey, my doctors or my labs have been saying that I have a high A1C. So I see I'm possibly diabetic. I have a high, numbers for hypertension. But then not only that, I see that my levels and my numbers are off. My kidney function is not the best way. Can you test me? And that's extremely helpful. So I know that we have about 12 minutes left, but I want to just give this to you guys, Dr. Joy, Dr. Creed. The floor is yours. Any lasting things that you would love to say or things that you would love to tell someone to know if you were in this position, what would you want to know? Right. And then what are some things that as you learned, even when you're going through med school, that you expected that was some textbook to now, like with your real world experiences?
I guess my takeaway would be, like you said, know your numbers, know what's healthy for you, know your family history, make sure you have your primary care physician, follow up with a nutritionist or a registered dietitian, make sure that you're exercising, that you're drinking the right amount of water, and obtaining a balanced diet. Also, write it down and keep yourself accountable. So that would be my takeaway, doing all of those things. It seems like a lot, and it is a lot. But as the older we get, we have to take care of ourselves. And so today is the day to start. The day's almost over with. So tomorrow is your day to start saying, hey, let me make these appointments. Let me line my day up with exercise and go ahead and write it down and just do what you have to do.
I think my takeaway for today would be is make it a family thing, right? We're gonna know our family history, like Dr. Joy said. I'd be remiss. My little kid, I got a 10 and a half-year-old daughter, and she's about 55 pounds. She a gymnast, so she's little, but she has high blood pressure. She was born with one kidney, and she sees a kidney specialist. She went to see all the days that I get to share about kidney health with you guys. She had a kidney appointment today, and she's always like, can we look at it? Can we see my kidney? And the doctor's like, yeah, we're gonna see it. So she sees it on ultrasound, and it's big and it's juicy and it's doing all the things that two kidneys would do. She has one that does all the work. And so in that, I'm like, she's 10. She takes high blood pressure medicine. It doesn't stop her life, but we have to be thinking of that. She has one kidney. Her blood pressure is up. there's some dysfunction in that one kidney that she has. Otherwise, she wouldn't have the high blood pressure. And so, as a mom, as a wife, as a doctor, I have to wear multiple hats in that and say, don't forget about your kids. We live in a very obese society. Our kids are getting grown up illnesses. Like they're getting diabetes, they're getting high blood pressure, they're getting kidney disease. Though my kid is neither of those, because she like soaking wet, little mini Simone Biles kind of little shape, but she has those things, and it wasn't family history. It was just kind of a fluke. She was actually born that way. So watch your kids, listen to your kids, pay attention to them, and get the blood work. Because as small kids, she's going to the pediatrician. The pediatrician not looking at any of that. So if her numbers are up and they're telling you something that to watch for, don't just say, oh, they'll grow out of it. Go see the specialist, dig deeper, because you never know what we're in a world of the Olympics right now. So you may be raising the next, gold medalists out there. So don't forget your kids, bringing them along for the walks. Make sure that when if you're on a diet, the whole house on a diet, right? If you're exercising, everybody needs to be exercising. So have those goals and make it a family affair, so that we're all living to healthy, happy, whole lives, and we can have a legacy, because we want to live long, and we want to live well. We don't want to be, hooked up to machines just to survive. We want to do that, and we want to pass it on to our kids, so that their kids and their kids can live those healthy, happy, whole lives as well. Thank y'all for having us.
Yes, thank you. That was good. We can't hear you,
You
Candy.
muted, Candice.
Now, how did that happen? But I think it was so great, so insightful, so informative. I saw someone early say that this was great information, right? And it is great advice. And I think that we could end it on, knowing your numbers, being your best advocate, and living your best, healthy, happy, whole lives, right? So as we know, the nutrition plug, Dr. Joi, is with nutrition. She is a nutrition coach. She's also an MD and a physician. And then also we will share that information out with you all as attendees. And then you have Dr. Cree as well, who is the owner of Brownstone Healthcare, and you could go see her for free. Both located in the Birmingham area. Thank you so much for joining us for this Community Connect. We will actually be hosting another Community Connect, so stay tuned for that. Dr. Cree, Dr. Joi, thank you so much. We appreciate that. And of course, always join our community at nowincluded.com, so you can come to the next event, in the next event, in the next event. But thank you all so much, and have a blessed night, you guys. Thank you.
Have a blessed night.
Bye.